Did you know that someone, somewhere in the world, has a stroke every 2 seconds? This means that by the time you finish watching this video, dozens of people will have experienced a stroke. It's a sobering thought, isn't it? That's a staggering statistic, painting a picture of a silent epidemic that affects millions globally each year. Strokes are one of the leading causes of death and disability worldwide, yet they often don't receive the attention they deserve. This silent epidemic continues to grow, impacting families, communities, and healthcare systems. Strokes don't discriminate. They can happen to anyone, anywhere, at any time, whether you're young or old, healthy, or with pre-existing conditions. The risk is always there. It's crucial to understand that strokes can strike without warning, altering lives in an instant. But the good news is that we're not powerless against this threat. Advances in medical research and technology have provided us with tools and knowledge to combat strokes effectively. Early intervention and treatment can make a significant difference in outcomes. By understanding strokes, recognizing the warning signs, and taking proactive steps, we can significantly reduce our risk and protect ourselves and our loved ones. Knowing the symptoms, such as sudden numbness, confusion, trouble speaking, or severe headache, can save lives. Immediate medical attention is crucial. This essay, inspired by the groundbreaking work of stroke expert Dr. Akoli, aims to demystify strokes and empower you with the knowledge to take control of your brain health. Through education and awareness, we can turn the tide against this silent epidemic. Join us as we delve deeper into understanding strokes, their impact, and the steps we can take to safeguard our health. Imagine your brain as a vast network of roads and highways, constantly buzzing with electrical signals that control every thought, movement, and bodily function. These signals are like tiny cars traveling at high speeds, ensuring that every part of your body operates smoothly and efficiently. From the moment you wake up to the time you go to sleep, this intricate system is always at work, managing everything from your heartbeat to your ability to solve complex problems. Now, picture a major traffic jam on one of those crucial highways, bringing everything to a standstill. Just as a traffic jam can cause chaos and delays on the road, a similar disruption in your brain's network can have serious consequences. This blockage can prevent essential signals from reaching their destinations, leading to a breakdown in communication within the brain. That's what happens during a stroke. A stroke is essentially a brain attack, where the normal flow of blood to the brain is suddenly interrupted. This interruption can be caused by various factors, but the result is always the same. Brain cells are deprived of the oxygen and nutrients they need to function properly. A stroke occurs when the blood supply to a part of the brain is interrupted or reduced, depriving brain cells of vital oxygen and nutrients. This can happen in a matter of seconds, and the effects can be devastating. Without a constant supply of oxygenated blood, brain cells begin to die within minutes, leading to potential brain damage and a range of debilitating effects. The longer the brain goes without oxygen, the more severe the damage can be. Without a constant supply of oxygenated blood, brain cells begin to die within minutes, leading to potential brain damage and a range of debilitating effects. These effects can vary widely depending on which part of the brain is affected. For example, a stroke in the part of the brain that controls movement can lead to paralysis, while a stroke in the area responsible for speech can result in difficulty speaking or understanding language. There are two main types of strokes: ischemic and hemorrhagic. Understanding the differences between these types is crucial for effective treatment and prevention. Ischemic strokes, the most common type, are caused by a blockage in a blood vessel supplying the brain, often due to a blood clot. These clots can form in the brain itself or travel from other parts of the body, such as the heart. When a clot blocks a blood vessel, it prevents blood from reaching the brain, leading to the death of brain cells in the affected area. Hemorrhagic strokes, on the other hand, occur when a weakened blood vessel in the brain ruptures, causing bleeding in the surrounding brain tissue. This type of stroke is less common but can be more deadly. The bleeding not only deprives brain cells of oxygen, but also increases pressure within the skull, which can cause further damage. Understanding the different types of strokes and how they affect the brain is crucial for effective prevention, diagnosis, and treatment. By recognizing the signs and symptoms of a stroke early, medical professionals can intervene more quickly, potentially reducing the severity of the damage. Preventative measures, such as maintaining a healthy lifestyle and managing risk factors like high blood pressure and diabetes, can also play a significant role in reducing the likelihood of a stroke. Early diagnosis and prompt treatment are key to improving outcomes for stroke patients, making education and awareness essential tools in the fight against this life-threatening condition. Strokes are medical emergencies that require immediate attention. They occur when the blood supply to part of the brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Within minutes, brain cells begin to die. The faster a stroke is diagnosed and treated, the better the chances of minimizing brain damage and maximizing recovery. Immediate medical intervention can significantly improve outcomes and reduce the risk of long-term disability. That's why it's crucial to be able to recognize the warning signs and act fast. Knowing what to look for and how to respond can make all the difference in a critical situation. The acronym FAST is an easy-to-remember tool to help identify the most common symptoms of a stroke. FAST stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. F. Face drooping. Does one side of the face droop or feel numb? This is often one of the first signs of a stroke. Facial muscles may become weak or paralyzed, causing one side of the face to sag. Ask the person to smile. Is the smile uneven? An uneven smile can be a clear indicator of muscle weakness on one side of the face. A. Arm weakness. Is one arm weak or numb? This symptom can manifest as a sudden inability to lift or control one arm. Ask the person to raise both arms. Does one arm drift downward? This can indicate muscle weakness or paralysis on one side of the body, a common sign of a stroke. S. Speech difficulty. Is speech slurred? Speech difficulties can range from slurred or garbled speech to complete inability to speak. Is the person unable to speak or understand what you're saying? Confusion and difficulty understanding speech are also common symptoms of a stroke. T. Time to call 911. If you observe any of these signs, even if they are fleeting, call 911 immediately. Remember, time is brain. The sooner medical help is received, the better the chances of recovery. Every minute counts when it comes to stroke treatment. Rapid response can prevent further brain damage and improve the likelihood of a full recovery. Don't hesitate to call for help, even if you're unsure. It's always better to seek medical attention and be safe rather than sorry. Quick action can save lives and reduce the impact of a stroke. It's always better to err on the side of caution when it comes to your brain health. Regular checkups, a healthy lifestyle, and being aware of stroke symptoms can help in early detection and prevention. Remember, acting fast can make all the difference.